Hello, great world. Welcome to Community Connected Health. I am a co-host, Skip Lowe, joined by
Colton Storla.
By the way, happy birthday, buddy.
Thank you.
Yeah.
Birthday week, birthday month.
You're looking good, man. Tell you, thanks for getting me all hooked up on your vitamins and the creatine. By the way, this is not a pitch for that by any means, but I'll tell you what.
Trying to stay young, fit.
Well, we got to look the part, and we got to act the part in this business, right? And that's what we're going to be talking about today is how do we do what we do, and just really excited about today's content just because we get to share the case studies. And you might recall a couple years ago when we started jumping into all this fun, I said, Colton, where it's going to start making a difference, where we're going to cross the threshold is when employers are going to say this is working great. Obviously, that's the easy part of this, but seeing the data and looking at the other side of the coin and saying, okay, we finally have the information and to be able to demonstrate that action to prospects and say, yeah, this is the people that are doing it. So, our content today is we're going to center on 4 different employers and
Community Connected Health at Work.
Yeah. Community Connect.
That's our title. There's our title.
There it is. We're rolling with that, right? And so we selected 4 different distinct organizations that are in different spaces. Some are in healthcare, of course, which is great because when you make the doctors happy, you can make anybody happy. That's what I found in life. And then we've also got people that are in the public sector and manufacture. And so I think the biggest challenge I had in this is when I got a phone call in a frigid January day from a former client of mine, and she had taken on a role at a new, larger organization, one of the most prestigious orthopedic groups in the state of Iowa. And since we're on TV, I won't use what she said, but she just said basically her plan was and then I said, yeah, I hear that a lot. And she says, let's get the band back together. For those of you that remember the Blues Brothers, I'm just referencing that great movie. But I said, yeah, let's have a talk. What's going on? And for the next 5 minutes, she just, dumped it on me. She said, the employees are very unhappy. The doctors are very frustrated. The chairman of our board, who is a board certified surgeon, says, this is just craziness. We don't know what's going on. Again, where is all this money going on? We have huge morale hazards. We're not recruiting people. This 5-10% increase every year is just driving us crazy. And so what you got? Yeah, I was just in that moment of truth. And I said, well, really trying to re-establish my career and just kind of just tear it all down and rebuild it and re-engineer where I'm at, because my DNA has always been there. I'm all about trying to help our communities, trying to spend our dollars locally, and then with what we're doing, keep the dollars locally. But how do you do that in healthcare when I've been crawling through piles of data for years and years, and each and every year it just feels like I'm pulling the string out of my neck? Like, hi, how are you? How are your kids? Sorry about your increase. We'll see you in 6 months. So it's just like you're a puppet. And I had an employer say, I walked in the room for an employee meeting. He says, here comes Dr. Death. I'm like, I need a sickle and a hoodie on at this point. The Grim Reaper's here.
Sometimes we have to deliver bad news.
Yeah. We do, but it doesn't have to be consistent. And so, so we'll talk about this group in a little bit more detail. And again, what do you got? And then she mentioned this group that I'm affiliated with and certified with was just Health Rosetta. Do you know anything about them? At that point, I wasn't affiliated with them. So who did I call?
Me.
Yeah. So I'd gotten to know you over a 2-hour conversation. So thank you for your kind time, because I was just like, man, light bulbs are just getting screwed in all over the place. And I'm like, oh my gosh, where have I been? I've been hiding underneath my desk. And it was, I was able to go ahead and deploy some of what I knew at that point. And I said, well, let's take a look at, your program, and let's see if we can't just blow it up. And, they have a traditional, won't name their name, but
carrier model.
And I said, you're going to have a TPA, you're going to have a insurance contract, and you're going to have a network, and then you're going to have a pharmacy benefit manager. But we're going to pick and choose the people that we think are going to do the best job for you under whole new principles. And we're going to grade your plan.